One of the most challenging and pressing public health challenges we have for this 21st century is regarding the digital dependency and substance use disorders among youth. So the patterns that we described and analyzed reveals that they are not any isolated behavioral problems, just a bad habit, just a moral failing, but they are deeply intertwined phenomenon, and we understand they are shaped by their past life experiences, traumas. There could be also a challenge in the neurodevelopmental vulnerabilities and systemic factors. So, in our discussion further, we require a capacity, a compassionate heart to go beyond an individual blame, that is, of punishment or pathology. We need to consider this pressing needs of our time to a broader biopsychosocial and our cultural dynamics and go forward outside our limits. Now, let us look for the first instance. The first discussion I would bring to you would be the neurobiological gap or the overlap that we have between that compulsive scrolling or between that binge eating or pornography. This suggests that both behaviors have got a same feedback system, engage in a similar reward circuitry. So we understand that it is a dopamine driven reinforcement, and this is a loop in which the social media parallel and also the chemical substances are going. So explaining why our young minds find it difficult to disengage despite of all the negative consequences, the pain, the isolation that they bring. So it is so important to take our adolescence seriously. So the adolescence. It is a critical window of neuroplasticity. They are, because the brain is still developing. We understood there is a limbic brain, there is an immediate reward system that is being activated. So somehow the prefrontal cortex activity is at risk and it is slowing down. So during this prefrontal cortex, since it remains underdeveloped and the limbic system is too much activated, this creates an imbalance and leaves the adolescents more sensitive to all the short-term instant reliefs, instant escapes. And this instant gratification and escape leads to a long-term trap and harmful, and this keeps active our addictive cycles. While there is some degree of risk taking and novelty seeking, which is normative for all ages and all times with the adolescent development, but we have to be mindful as a trauma informed care provider whether there is a trauma that is fueling all this. If there is any maladaptive coping only because of ongoing stress and emotional negligence or aloneness. So we have to be careful and try to bring out those patterns of dependency.